Standard CS wheelchairs come in two main styles, attendant propelled and self-propelled. They come in various sizes, 15x16, 17x17 and 19x17. The video demonstrates the application and release of brakes. Brakes should be applied for all transfers.
Foot plates come in two different sizes. Ensure you have the correct fitting for your chair. Foot plates are removed by pushing the small lever to release the plate. When reapplying the plate, ensure that the pegs are lined up to slot into place. Make sure the foot plate clicks back round and is secure. When transferring, ensure foot plates are out of the way.
Armrests can be removed to support lateral transfers. These can be removed as demonstrated by turning the latch to allow the pin to be released. To reattach the armrests, align as demonstrated. Ensure the latch is back in place and the armrest is secure. There are two main types of CES wheelchair cushion provided, a 2-inch foam cushion for the 15x16 and 19x17 inch chairs and a 4-inch ProPad cushion for the 17x17 inch chairs. Make sure your cushion is the right way up and the right way around to fit into the chair.
To fold the chair, you remove the cushion and you pull up from the centre of the seat canvas. To fold the backrest down, you slide up the two levers. Folding out the wheelchair, lift the backrest up and the levers will slot into place. Repeat this in reverse to fold out the chair. The comfort strut is provided for a 19x17 inch wheelchair to support the backrest.
A lap belt is provided for all wheelchairs. Ensure this is adjusted to your patient's needs. The lap belt should be secured whilst the patient is in transit. To adjust the foot plates, you will need an 11mm spanner. In order to assess for the correct foot plate height, it is essential that you seat your patient in the chair. You are looking to achieve 90 degrees at the hips, knees and ankles. To achieve 90 degrees at the hips, knees and ankles, you must adjust the foot plates in accordance to your patient. To do this correctly, you should sit your patient in the chair and adjust the foot plate accordingly. Once the correct position is achieved, use your spanner to tighten. Review the position that your patient is sat in to ensure that 90 degrees has been achieved.
When sat in the wheelchair, we need to ensure there's a small gap down the side of the thighs to look after skin integrity. Next, we're going to show you how to adjust an elevated leg rest. To adjust the elevated leg rest, you need a 13mm spanner. To adjust the calf support, you need to undo the nut and place to one side. You can then remove the calf support and the wooden and rubber washers. You can then slide the metal bracket up and down and place on one of the 3 nodules that is on the elevated leg rest. To put the calf support back in place, there needs to be a washer next to the nut. This is followed by the wooden and rubber washers, consisting of 2 round pieces of wood and a washer in between them. This is then placed back into the metal bracket. The calf support is then threaded through the bracket and then tightened in its new position. The elevated leg rest fits in the same way as a standard foot plate. You can adjust the angle of the elevated leg rest by the silver lever as demonstrated in the video.
Next, we will show you how to adjust a stump board for an amputee using an 11mm spanner. The stump board attaches in a similar way to a standard footplate. Adjust the stump board in accordance to your patient's needs. You can adjust the height of the stump board as you would a footplate.